to the price of medicines or drugs, if you like. Would like to hear from you this morning what your thoughts are. And this particular subject matter is against the backdrop of a particular headline that made rounds yesterday, I think on the Nigerian Tribune newspaper, where it was reported that there's still an increase in the price of drugs despite federal government intervention. And we thought it wise, to bring in experts so we can dissect the issue and to know what, the issues are. My name is Omoife Piso Semere, and I will be having this conversation with a pharmaceutical industry expert, the person of Dr. Nuruddin Osman. He joins us live via telephone from the seat of the Caliphate, Sokoto State, this morning. Good morning to you, Doctor.
Good morning.
All right.
Good morning, listener.
Thank you very much. Now, let's quickly, give a background to the conversation this morning. The recent price surge in conventional medicine has led many people to seek alternative forms of healthcare. Traditional medicine, which has been practiced for centuries, is actually one of such alternatives. However, the question remains whether traditional medicine is a better alternative to conventional medicine, especially at this time that Nigerians have actually recorded quite a significant surge in the price of medicine or drugs. Traditional medicine refers to the use of plants, animals, and minerals to prevent and treat diseases. It is often practiced in conjunction with spiritual and cultural rituals. In many African and Asian countries, traditional medicine is the primary form of healthcare. However, its effectiveness and safety have been questioned by many in the medical community. All right. And traditional medicine has been practiced for centuries, long before the advent of conventional medicine. Many traditional healers have passed down their knowledge and skills from generation to generation. Now, when you take a look at some of the factors that, have even, further pushed, the consumption of traditional medicine, one would take a look at the economic factor, which is of course a major factor that has now pushed Nigerians, to even consuming traditional medicine. Right. The price surge in conventional medicine has made it unaffordable for many people, especially in low-income countries. And traditional medicine, on the other hand, is often cheaper and more accessible. But of course, the conversation around how safe it is and the right proportion that people must consume is one that we've not been able to really reach a point of departure on. So the much reason why we have you on the show this morning, Dr. Nuruddin Osman, and we hope sincerely that you'll be able to analyze this issue for us very critically. To start with, we understand that a number of pharmaceutical companies, they've exited Nigeria. And as at when this trend started, I think sometime last year, it also brought about this, surge or spike in the cost of conventional medicine. It has been sparking a lot of reactions, Nigerians are saying that if we continue like this, the implication will not really, be too good, for Nigeria's health sector. But I'd like to ask you, let's start a conversation on this note, as to what your observations are with regards to, the price surge in conventional medicine in Nigeria.
Thank you very much. Good morning, listeners. Let me start this way. Let me by the word access. We're talking about access to medicines. Question of availability, affordability, and cost. In most low-income and middle-income countries has been a very great challenge for a very long period of time. Okay. But when we talk about this particular access in Nigeria, from the context of our prevailing economic circumstances, where we are all witnesses of the skyrocketing prices of drugs, we begin to see some kind of extraordinary costs in the last couple of months, or let's say in the last 2 years, especially with the kind of policies we are seeing, which the government is government is trying to kind of put the economic on track. So when you talk about this type of access, what makes Nigerian situation very unique is over dependence on imported medicines. As I speak with you, currently the medicines we consume in Nigeria, 70% of it is being imported. Okay. That means we are left with only 30% for local manufacturers, that is to be manufactured locally. And of course, one shocking news about even the 30% we produce in Nigeria is that over 70 to 80% of the raw materials, when you talk about raw materials of drugs, we are talking about basically majorly two things. The active pharmaceutical ingredients, we call it API, which is the main drug, okay, and other excipients. That means the other materials or other ingredients that are used in the manufacture of the drugs. So over 70 to 80% of the locally manufactured, 30% are also imported. So this over-dependence in this type of economy is actually responsible for most of the predicaments Nigeria is witnessing today in terms of skyrocketing prices. Okay. Therefore, the common man has limited access, that is limited access to availability, affordability, and cost of especially orthodox medicines. Okay. So, in the last couple of months, after several cries and other issues, the government decided to intervene. The government, our president signed an executive order, precisely I can see June 28th last year, and after signing the executive order, it had to go through a lot of processes before the implementation. But to the surprise of many, even after the implementation, several months into the implementation, we are still witnessing a surge in the prices of the drugs. One of the things we must look at is what were the reasons. One of the reasons, as you rightly mentioned, is the departure of some of the pharmaceutical companies. Specifically, we can talk about GlaxoSmithKline GSK, which is a UK-based company, and another French company, Sanofi, which is also a French company that exited Nigeria and contracted the distribution of their drugs to a third party. So this has compounded the Nigerian situation in local manufacturing. Of course, those companies were not 100% manufacturing in Nigeria, but at least their being in Nigeria has made some of their branded products, which Nigerians are eager to see, the Augmentin and the rest of them, has made them a little bit more available and more affordable for the common man. But when they began to... You said?
Did you say that the exit of these pharmaceutical companies, it has actually made some of these drugs, to be more affordable for Nigerians? Is that what you're positing?
Yes. Actually, before the exit, one thing that started to happen, which the companies have given as the major reasons for their exit, is Naira devaluation. We are all witnesses of the fact that immediately this government came in, decided in their own economic model to float the Naira. And floating the Naira has made the dollar-Naira exchange very, very unstable. And these are foreign companies. Their own transactions and everything are in dollar. So access to dollar as a result of Naira devaluation and serious instability in the exchange process made them to start to complain about losing a lot of grip in their profit margin, because they are not able to access dollar to be able to recoup their investment, to be able to recoup their profits. So at the end of the day, they had no option. So some of the reasons, the Naira devaluation is part of the reason. The surging inflation, which the inflation we are all witnesses, is affecting almost every sector of the economy, and the drugs are not immune to that. And of course, you must also look at other factors such as significant infrastructural deficit. Nigeria, if you have a company where you're going to produce drugs, one of the major challenges you're going to have is just if you stop at power alone, to be able to generate power, which is one of the major infrastructure. So all these things put together made the government to come in and brought up the executive order. But now, what happened to the executive order? When you look at these are the reasons. Just as I mentioned earlier, the departure of those companies, the naira devaluation, the inflation, and of course significant infrastructural deficit brought about the intervention of the government in the name of the executive order. And of course, the executive order came in, and after implementation, now look at if we were to go out and look at the executive order, then you realize that what the executive order has done is just to look at one aspect of the entire gamut of the problem.
Which is?
Because the executive order is very specific about waiving import duty or import tariffs and VAT on raw materials. Those raw materials I earlier mentioned, which are used for the production of locally made products, pharmaceuticals, that is drugs, machineries, medical equipment, diagnostics, and some other medical devices such as syringes. So anytime you're importing those things, the government decided that there should be no imports or tariff or any VAT. Of course, when you look at this, you realize that it is a step forward, and we must commend the government for bringing this type of policy to be able to encourage local manufacturers to get access to raw materials for them to be able to manufacture.
Just to jump in, Dr. Nuruddin, how many manufacturers do we have in the country at this point in time? Are you privy to any information in that regard?
Yeah, actually, the problem of Nigeria is data. But the statistics I've told you earlier will show you that there is a significant problem in Nigeria in terms of manufacturing. Just like I said, majority of our manufacturers in Nigeria resort to importation of finished products, not even raw materials for local production, because 70% of the drugs we consume are imported, and we import drugs from Asia, countries like India, China, and the rest of them, and we also import a lot of drugs from Europe. So what I'm trying to say is that majority of our local manufacturers do what we call contract manufacturing. You can have you can establish a company right now in Abuja, and the next thing you go to China and find another company that is going to be producing drugs in the name of your company.
Okay,
then you have to go through the process and be importing the finished products. So that is why one of the aim of the executive order is to discourage this type of practice, whereby the local manufacturers will now be encouraged by way of waiving taxes and import duties on those raw materials to continue to do that. So what I'm trying to say earlier is the government only looked at the supply side of the problem. That is the importation. That is the import duty and tariffs, or the VAT itself. But even within the imports, for someone to take, for example, drugs from China to Nigeria, you have a lot of hurdles to go through before that product comes into Nigeria. So and in the first instance, you have to use dollar. If you are using dollar to import, even if at the end of the day, because if you are importing finished products, that executive order does not capture finished products, then automatically the finished products are going to be. Of course, the intentment of the bill initially was to discourage this practice and encourage manufacturers. But the manufacturers, because they still have to use the dollar to get the raw materials, they have to ship the raw materials, they have to battle with regulatory agencies within the port and other things, and they have to deal with infrastructural deficits. So this has made completely the gains from the executive order to be completely not felt by anybody, because at the end of the day, that dollar that continues to depreciate continues to impact on the importation of the raw material. Therefore, there is no difference.
Okay, so Dr. Nuruddin, I'm sorry, but if you'd let me, why is it difficult to source, for these materials internally here in Nigeria? We don't have what it takes?
Yes. If we are going to talk about why those materials are not sourced in Nigeria, we are now going to turn our attention to some additional problems that make our industries not to be able to produce locally. And that problem is lack of support in research and development. Raw materials are not like groundnuts, maize, corn, and the rest of them that you just go to the farm and start building. It requires a lot of investment and research and development.
Okay.
And until when those researches are done and those things are fully validated and evaluated, then that is the only way you begin to have planting of those raw materials, processing of those raw materials, because to process the raw materials themselves, it also requires the same companies to go into another manufacturing, because the raw materials are being manufactured after getting them from the farm, some of them, or if you are not getting them directly as natural raw materials, you also have to use the lab to synthesize them. So this calls for development of research and development. We have a lot of research institutes that are lying dormant in Nigeria.
Okay.
Right now, here in Abuja, there in Abuja, you can talk about National Institute of Pharmaceutical Research and Development. You can talk about National Institute of Medical Research. You can talk about so many. And we have a lot of pharmaceutical faculties and science faculties that are working on it. But all those researches are not supported. All those researches are not being funded. And those people carrying out the researches, as I speak with you, are the ones we are talking about, Japan outside Nigeria.
So
they are
who is supposed to fund, these research that you're talking about?
You see, funding research is actually a multifaceted thing. Of course, one of the primary contributors to funding research, especially from the context of African countries, is government. But of course, you must talk about private sector. People have to go into research with a lot of... First and foremost, the government must provide an enabling environment for the research and development. And of course, the research and those people carrying out the research must be supported. When you talk about going into research today and you're looking for several millions or billions of naira or millions of dollars, definitely there must be access to very low interest loan. There must be several incentives, especially if the researchers are able to produce something good, and all these things are there. So there must be coming together of the government, private sector, individuals, healthcare practitioners, and a host of others in order to be able to make the research work.
Okay.
And until that happens, there is no way we are going to have raw materials in Nigeria. We are going to continue to import the materials we will use in the manufacturing of our product. And as long as those raw materials, even if you are going to waive import duty and VAT, at the end of the day, the dollar problem, the cost of other things like shipping, storage, the infrastructural deficit is going to continue to impact on them. And of course, at the end of the day, you see the prices continue to go high and high. So, in my earlier explanation, I am trying to tell you that the government only try to solve a section of one side of the problem, which is the supply side.
Okay.
Because in the supply side, you have the importation problem, you have the manufacturing challenges, where I talk about the infrastructural problem, the funding problem, and the rest of them. And of course, one major factor in manufacturing in Nigeria is regulatory environment. Right now, if you want to start producing any drug in Nigeria, you have to go through a very, very stringent regulatory environment that consumes a lot of money and time. So you go into that kind of production with your 100 million or 200 million or more than that, or even a billion naira, and if you are not careful before approval is given to you, it might take you 2, 3, 4 years.
Okay.
I am not sure if anybody is willing to put in his money and continue to wait. We have National Agency for Food and Drug Administration and Control, NAFDAC, which is one of the major regulators that you have to liaise with. You have to go through a lot of processes. You have the Pharmacy Council of Nigeria. Even though Pharmacy Council of Nigeria's regulation is not as stringent as that of NAFDAC, you have to go through a lot for you to be able to have the approval, right from the building, the machines, and the processes of carrying out certain evaluations and inspection, and the standard operating procedures. All these things have to put together, and if you're not careful, at the end of the day, you might have to abandon it and go and start looking for another business.
Okay, so Dr. Nuruddin, I'm afraid I have to butt you again because we are working with time, and I really like the fact that you're trying to be very, very elaborate on some of these issues that you are highlighting. But with the exit of GSK, for example, this big or top pharmaceutical firms from Nigeria, isn't that supposed to be a blessing in disguise, and perhaps, give the government of the day more reasons, as it were, to go back to the drawing board and put things in place for us to manufacture drugs locally and also consume them locally?
Yes, yes and no. Let me tell you, the exit of those pharmaceutical companies, if you look at it from the context of encouraging local content, especially from the policies of the federal government in trying to see how they can develop our local content, you can say if we are to go by the theoretical framework, yes. But if you are going to go by reality, let me tell you, the meaning of those two companies exiting Nigeria is people losing their jobs. A lot of Nigerians were working with those companies, and they have to lose their jobs.
But if we create an enabling environment here in Nigeria where drugs can be produced or manufactured locally, jobs will still be created.
Yes, that's what I'm trying. Where I'm heading to. Okay. When you look at the fact that those companies have gone, and the executive order immediately was signed into law, one of the intentment of the executive order was to see how to create a kind of competition between importers of finished products and manufacturers of local products. In the sense that if those outlines, guidelines in the executive order have been well harnessed, which I hope in the coming days and in the coming months, government is going to bring several experts to come down and look at the executive order and probably update it and try to see how they can incorporate certain things. So what I'm saying in essence, when raw materials that are coming are no longer taxed, are no longer giving a lot of so many burdens in order to inflate the prices of the raw materials, then at the end of the day, the end product we produce in Nigeria will be very cheap as compared to the finished product that will be imported. Okay. So this is the thinking of the government. So that at the end of the day, naturally the importers will begin to come back to manufacture locally. And in that context, when you put that side by side with the exiting of those multinational companies, that would have also add more weight to the manufacturing locally. That is, if the infrastructural deficit is addressed, if the funding issue is addressed, if the expertise is addressed, and all other factors that are militating against the manufacturing inside Nigeria are also addressed. But as long as they continue to exist, that means the exiting of those pharmaceutical companies can only make things worse. Because as it is right now, we are experiencing worse situation when they were in Nigeria.
Okay, so in a yes or no response, I mean, drugs like paracetamol, right? We also have ibuprofen. Basically, pain relief drugs. They've become so expensive now. So it's also because of the devaluation of the naira that these drugs have become so expensive. In a yes or no response.
Yes. Not only paracetamol painkillers. If you want to talk about paracetamol painkillers, if for example, paracetamol is just an over-the-counter drug, no matter how much expensive it is, you might just finish your program today when you have some little kind of stress. People will just walk into any pharmaceutical premise, get paracetamol, take with your 200, 300 naira. But the main drugs we are talking about are life-saving drugs.
Right.
Life-saving drugs like antihypertensives, those people suffering from hypertension, diabetes, and of course, more importantly, patients who are being managed on cancer.
Okay.
These are people that have to take drugs like food. Because when you just take paracetamol today, you might not take it tomorrow, next tomorrow, or even next month.
Okay.
But people that take drugs to manage hypertension, to manage diabetes, and those who are on cancer treatment, those who are managing asthma, these are chronic disease conditions, especially the asthma, diabetes, and hypertension, that the people from these diseases have to take drugs for the rest of their lives.
Absolutely.
The way they buy food, that is the way they buy drugs.
Absolutely.
So tell me how sustainable this is going to be.
I mean, I think that was last month, World Diabetes Day. Diabetic patients, they actually raised concerns with regards, to how expensive these drugs have become. And that has also contributed to, the data or the figures, in terms of people who die annually, as a result of diabetes. But that's just by the way. Now, aside life-saving drugs, right, Nigerians, some of them, not all now, some of them are now reverting to traditional medicine. Reasons being that it's actually cheaper, right? It's more affordable as opposed to the conventional medicine. But as a pharmacist, do you think, or would it be right to say that traditional medicine is now a better alternative to conventional medicine?
This is a very difficult question to answer, especially on a live program like this, because of course, I'm going to answer your question, but I want to refer us back to the executive order. One of the implications of implementing the executive order, among the many benefits the government has thought of having to impact on Nigerians, is public health protection. And public health protection can be seen from two perspectives. Considering the fact that we have significant health deficit in terms of healthcare facilities in Nigeria, and to the point that people usually resort to private healthcare facilities rather than government healthcare facilities due to that. And at the end of the day, they go into those type of facilities and get all sorts of treatment without proper regulation and without any transparency in pricing. So therefore, the prices you get from majority of the private organizations do not have any yardstick. Therefore, the way it continues to rise up without any rational or significant justification, people have to start to think of alternatives because they.
But Dr. Nuruddin, some of these yes, private health facilities are actually owned by doctors working, in public hospitals. True or false?
You see, this is another long discussion. Hospitals can be owned by anybody.
Okay, no, because you're talking about the price. You're talking about the
when you talk about ownership, you're talking about ownership. If you talk about ownership, private hospitals can be owned by anybody. You yourself can go to Ministry of Health in your state or in the federal government, go through the processes and establish a hospital, either maternity or any type of hospital you will. The only caveat is that you must employ competent health personnel, and you have to show evidence to that for you to be given license to operate.
Okay, that's by the way.
The most important thing about this thing is when you say private hospitals, you are talking about profit-making organization. And anywhere you have this type of situation where people have to make profit with health of individuals, then it is dangerous. So this is one aspect of the traditional medicine I want to talk about. And the other side, people don't have money to access. So therefore, the government brought that executive order in order to have access. That means to make drugs available the way the orthodox medicine, to make it affordable and to make it to have a very low cost for people to afford. And that way, public will be protected. But now coming back to traditional medicine. These traditional medicines, it is true, they have a long, in fact, have been there from the time immemorial, and nobody can argue about the efficacy, nobody can argue about most of the benefits, the traditional medicines. And when you talk about traditional medicines, we know definitely we are talking about the totality of knowledge, skills, and other things that are associated with culture and beliefs of people on how to go about managing ailments. And part of this is the use of herbal medicines. And when you talk about herbal medicines or mineral elements or animal elements to make some concoction for people to take, then in the context of Nigeria, people must be very careful. While we can say directly that yes, people at the moment do not have any option because of the exorbitant prices of the orthodox medicine or Western medicine. A lot of Nigerians don't believe in traditional medicine, and a lot of Nigerians believe in traditional medicine. So in the two sides, one thing we have now is we are now having a general consensus of people going into that. So now the danger here is here. The traditional herbalists, usually, especially a large number of them, do not have significant training on how to go about making or formulating those products. That is one. the safety component of that is also in question, because majority of the claims you see in traditional medicines, I said majority, that is not to say completely traditional medicines do not have any value, but majority of the traditional medicines you see, especially being advertised in a lot of local media, they do not have scientific basis. And you see a lot of bogus claims. And those bogus claims are significantly false. And a lot of them contain a lot of adulteration, contamination. There are also toxic substances that are supposed to be evaluated. So in the midst of the type of country we have and the type of people we have, where people are looking for drugs to manage without money, and people are looking for cheap medication, that things that are very that are not costly. So therefore, anyone can come up with anything and claim that that thing is anything, and people will begin to go.
Okay.
But as we change into that, we go and patronize those people, we must be very careful to be able to identify those who are genuine and those that are relatively safe for us to consume within the stipulated region. Thank God, at least NAFDAC is trying, even though with a lot of inadequacies, because the NAFDAC itself will tell you that it has a lot of challenges regulating the herbal medicines in Nigeria. But at least the first thing to do is to look at NAFDAC number. Even the NAFDAC number itself, I can tell you, a lot of people have a lot of misconception about the NAFDAC number.
Okay.
So therefore, they use the NAFDAC number to also say so many things that the NAFDAC number does not represent.
All right. Dr. Nuruddin, I'll let you hold your thoughts because we've got bills to pay, right? When we come back, from that commercial timeout, there is another question I'd like to ask you. So I'll just, hold my thoughts. And, when we come back, the conversation will continue. So do join us again. And to those listening out there, do well to, join us across, Facebook and YouTube, because the program is being streamed live. Do well to drop your questions. Any question at all that is bothering your mind, please drop it on, Facebook or YouTube. And of course, my guest, would actually address some of these, concerns that you have. This is Eagles Outlook, live on Eagles FM 102.3 Abuja. We'll be back after this time out. Do join us again.
Eagles 102.3 Abuja.
Ilimi babban abu ne gunmu shi zai kankan ya mutuncinmu.
A kowane ƙarni a kowace irin al'umma da ilimi ake tinka. Yanzu fa tazarar tana ƙoƙarin ta kai tazara.
Musamman mu 'ya'ya mata da a wannan zamani ya kamata a cusa mu makaranta. Sai aka bar mu da yawon gararan ba da tallace-tallace.
Ashe kaga ya zama haƙƙi ga iyaye da kowa mai hanin jinka.
Mu tabbatar da ana cusa yara makaranta.
Su samu natijar ilimi su daidaita da zamaninsu.
Kuma zamanin su ya tinƙaho da su. Amma rashin sa yaran a makarantar ya jawo an mana tazara a kowace harka ta rayuwa.
A Najeriya kimanin yara sama da miliyan 20 ba sa makaranta.
Har ma masu kididdiga suka ce miliyan 8 a kudu, miliyan 12 a arewa. Shi yasa hukumar ilimin bai ɗaya ta ƙasa wato UBEC ta ce
mai kafaɗa da kafaɗar tunani wajen cusa yara makaranta.
Domin gadon ilimi ya fi gadon dukiya.
Wannan sako ne daga hukumar ilimin bai ɗaya ta ƙasa wato UBEC.
Himma da ƙwazo ƙoƙarin mushinku jama'a kiranmu nake bisa dagewa.
Eagles 102.3 Abuja.
Please listen to this infomercial.
Hello Nigeria. Hello Africa. Do you want to work in the healthcare sector? Do you want to be a trained, certified nursing assistant, medical assistant, or caregiver? If yes, then register to enroll for Push Africa's 1-year diploma in certified nursing assistance training happening at the African University College of Science and Technology, Abuja. Targeted trainees are unemployed graduates, O-level or ordinary diploma graduates, or anyone interested in working as a support worker in the healthcare sector. For details, log on to www.pushafrica.org or WhatsApp 080-339-42015, 080-339-42015, 080-339-42015. For registration, pick up application form at our partner radio stations or visit the reception at the African University of Science and Technology, Abuja.
I don't need no liquor. I'm intoxicated by you.
My country people, who work is supposed to enjoy you after all the hustle. You not supposed to take your comfort play to fit sleep the way it's supposed to be. Make you go grab a yo-yo Eurofoam mattress. Make you forget your full comfort. Whether na Euro Spring, Euro Orthopedic, or semi-orthopedic, Diamond and Diamond Plus. And for Comfort Pro Max, Eurofoam don't introduce latest in town. That na Euro Elite. This one, they sleep jolly meant no get equal. Eurofoam get quality pillows and sheetings. Eurofoam shop yakpa everywhere for Bodo Nigeria. Eurofoam, sleep the
Abuja.
Please listen to this infomercial.
Hello Nigeria. Hello Africa. Do you want to work in the healthcare sector? Do you want to be a trained certified nursing assistant, medical assistant, or caregiver? If yes, then register to enroll for Push Africa's 1-year diploma in certified nursing assistant training happening at the African University College of Science and Technology, Abuja. Targeted trainees are unemployed graduates, O-level or ordinary diploma graduates, or anyone interested in working as a support worker in the healthcare sector. For details, log on to www.pushafrica.org or WhatsApp 080-339-42015, 080-339-42015, 080-339-42015. For registration, pick up application form at our partner radio stations or visit the reception at the African University of Science and Technology, Abuja.
Eagles 102.3 Abuja.
Glad to know you're still there, and thank you so much for staying with us. This is Eagles Outlook live on Eagles FM 102.3 Abuja, and on the program this morning we are looking at the recent price surge of medicines, and whether or not traditional medicine is now a better alternative, all right, to conventional medicine. And this is probably because of reports and concerns that have been raised in recent times, by Nigerians, that conventional medicines have become too expensive, and some of them are left, with no option but to revert to, a traditional medicine. And I've been having this conversation with a pharmacist, Dr. Nuruddin Usman, who actually is on the phone. I'm in live from Sokoto State this morning. At this juncture, you can call in to share your thoughts on the topic of discussion. What exactly are your thoughts? Has traditional medicine really worked for you? And if not, please let us in. And what also are your thoughts with regards to the spike or surge in the price of medicine in Nigeria? The numbers to call are 090-8766-8888. You can send a message to the WhatsApp portal on 090-9705-4450. Let's hear from you. You can also reach us on 090-7353-0044. Now, please, when you call in to share your thoughts, please stay civil, like we'd always, urge you to do, and then maintain 2 minutes or less, so we can accommodate diverse views on the program this morning. Is traditional medicine a better alternative, especially as it relates to, the price surge that Nigerians are now experiencing, or they are experiencing at the moment? What are your thoughts? And then, of course, I did say that I was going to ask my guests, a question, because it's actually cautioned Nigerians on the use of traditional medicine, especially as it relates to the right, proportion that one should actually consume. And then, Dr. Nuruddin, thank you so much for staying on the line. Okay.
Thank you.
Yes, I did say I was going to ask you a question with regards to, traditional medicine, because knowing that traditional medicine actually refers to the use of plants, animals, and minerals, to prevent and treat diseases. There is this one that is quite popular. I don't think I'm about to ask you about, Agbo traditional. I'm sure you've heard of that before.
Yes.
Okay. The one I want to ask you now has to do with dogoyaro leaves. I mean, you are in the north, you're in the core north, and this is something that is quite prevalent there. What are your thoughts on that? How effective is dogoyaro leaves, for example?
You see, there are a lot of herbal drugs of Nigerian origin that have a lot of potential, that have a lot of medicinal value. We call it medicinal value. And Dogoyaro is a plant that has extensively been studied for several years, and it has proven to have contain a lot of constituents that are of great benefits. But one thing I want to tell you about medicinal product is that not only Dogonyaru, we have a lot of other Dogonyaru. In Hausa we have Zogale, we have a lot of other ones. One thing I want to tell you about medicinal products is that almost every plant that has medicinal value, that medicinal value is usually attributed to a section of the chemical constituents in that particular plant. And that chemical constituent is sometimes is present in small quantity, while sometimes is present in large quantity. But together with that medicinal constituents that have the potential to cure or to bring down certain ailments, there are other constituents that could have potential harm to some vital organs. So the idea of training traditional healers or traditional herbalists is to be able to know how to take away the important component of every plant and be able to explore or exploit the use that in the management of disease. That is exactly what it is. So all those plants that have potentials or that have medicinal value, it's true, they have medicinal value, but by the time you pick up any like that Egbo, Egbo is not probably a name of, I'm not sure if it is not a name of a particular plant, but it's a name of mixture. Majority of the herbal products you come across herbal products that have several plants inside. And one of the things you will notice, or you'll be battling with the herbalist, is for them to tell you exactly the content and to tell you the various ingredients within, because the moment you begin to do that, they will feel you are trying to take away their patent rights. And that is one of the significant challenges we have with them. And for you, for us in the university and as pharmacists, and even learned people, one of the things that bring us at loggerheads with many of them is we want to have scientific base for any claim. People that push those traditional medicines come up to tell you those bogus claim I said earlier. They will tell you it kills HIV, it kills hepatitis, it kills this, it kills that. And majority of these things they say do not have any scientific backing. And even the World Health Organization has recommended the use of traditional medicine, but only when it has scientific backing. So the moment you see anyone coming to claim that his medication cures this or cures that, then automatically the next thing in the academia or in the research institute or in scientific fora we begin to ask is, what is the content? What is the magnitude? That is, what is the quantity of those content in the system, and what is the safety profile, and of course, what is the scientific basis? And the moment these questions are not answered, then automatically you begin to have suspicion. But NAFDAC has done something good by allowing them to go into a lot of processes and be able to have number. And having NAFDAC number means listing. But when you go on local stations and some other media organization, you see someone that has a NAFDAC number coming to tell you that his medication cures this or cures that. When in reality, the NAFDAC number does not evaluate claim. What they normally do is just that NAFDAC has provided a platform where you are labeling, your advertisement, and of course, the purity and a short time safety of your products have been ascertained. Therefore, it has been listed.
And not necessarily the efficiency of the product.
Not necessarily the claim. For example, if you develop something, you say it cures malaria. NAFDAC does not have problem with that curing of malaria, but NAFDAC does not evaluate curing of malaria, because if you want NAFDAC to evaluate curing malaria, it means your product must go through clinical trial. And if your product has to go through clinical trials, it means you have to spend a lot of money and wait several years for your product to be out. But the fact that because of the belief and the way and manner Nigeria wants to encourage traditional medicines, that has been taken away. Therefore, NAFDAC will now test for short-term safety. I'm not saying even long-term safety. That's what we call acute toxicity test. And NAFDAC will now evaluate your advert. NAFDAC will evaluate your label. Then at the end of the day, NAFDAC will now list your product. That listing, that is the meaning of number. Meaning, at the time your product is given NAFDAC number, it means you are now allowed to sell, and it is expected that the consumers of your product will now report anything that they feel abnormal to NAFDAC. Over time, NAFDAC will continue to monitor. Such that if anything untoward comes up along the line, NAFDAC will now call back your product and now begin to evaluate what the problem is.
So in summary, what you are saying is consuming anything that is approved by NAFDAC does not, essentially mean that the thing is actually safe for consumption. So if you have, if there are observations,
very specific about herbal products.
Okay.
When you have
we are restricting this to herbal products
approved by NAFDAC.
Okay.
If you have an orthodox medicine and other product that's approved by NAFDAC, that Western medicine must have gone through clinical trial, whether in Nigeria or in the country you are importing. And these are some of the regulatory stringent measures I told you. If you are buying paracetamol, for example, from India, if that paracetamol has not gone through clinical trial, then there's no way it can be approved by NAFDAC.
Okay,
let's orthodox medicine, NAFDAC does not give that kind of waiver.
Okay, let's quickly take some of the messages that we have on here. Abbas reporting from Dutse says, good morning, Omoefe. I think the problem of pharmaceutical companies and others, exiting Nigeria should be put in check. In other climes, when a company is going into administration or winding down, that company is expected to float, its share or sell the assets to potential investors. But why is Nigeria or Nigerian why is it different here in Nigeria? We see this company folding up and running away while their facilities and structures are abandoned to rot away. This needs to be stopped, okay? There are potential investors who would have, that would have acquired these companies and continue production where they stop. So drugs can be cheaper in Nigeria. He went for that to say that he is actually, okay, I use both orthodox and traditional medicine concurrently, especially on illness where orthodox medicine fails to totally eradicate the symptom. Why I like traditional medicine is because it is multifunctional in nature and it cures multiple illnesses or diseases. Okay, this is Abbas reporting from Dutse now. So this is a perception that someone actually, is used to or has been able to be subjected to, let's put it that way. He is subjected to this, a perception, talking about traditional medicine and also conventional medicine. And then this person, Terikin Bihundu says, good morning. If I'm listening from Nasarawa State, I greet your guest. Just like every other thing in Nigeria, after the removal of fuel subsidy, the price of drugs increased by more than 40%, making it difficult for poor Nigerians. But still worse, some hospitals may prescribe drugs for patients. You keep looking for it without getting it. Lastly, are people who claim to manufacture drugs in Nigeria collaborate with foreign companies and manufacture fake drugs, bring it into Nigeria. Those who take fake drugs unknowingly, they die gradually as their health continues to worsen day by day, while the sellers make more money. NAFDAC has to do more to fish out those dealing on fake drugs. Terry Kimbi Hundu right there. So somehow this message is not it's not completely different from your reservations, talking about NAFDAC giving listing some of these traditional medicines or giving them numbers for them to be able to sell their drugs without necessarily certifying if these things have been scientifically proven. But at the end of the day, Dr. Nuruddin, because we're actually working with time, what exactly is the implication of all of this for Nigeria and Nigerians in terms of health?
Actually, it is unfortunate that we find ourselves in this kind of situation where the common man cannot afford cannot access care at his doorsteps. And one of the major problems is we have problems of lack of funding, we have problems of infrastructural deficit, we have problems of even awareness, that is literacy. People are not aware. And of course, a lot of all these things, when you put together, they amount to they will amount to insecure health. That means the intentment of Nigeria to protect the public health wise is now defeated, because people have to start looking for all means by which they can actually access care. A lot of in our hospitals today, you talk about only 5% of Nigerian access National Health Insurance Act. That is what we formally call NHIS. Therefore, majority of Nigerians have to pay their care out of pocket because the insurance is not working. Majority of the state governments are not doing anything about that. The local government is lying down fallow. So definitely, at the end of the day, we expect people are going to continue to have to scamper around for management of their ailments, and not to be a prophet of doom. Remember when the COVID struck Nigeria unawares, everybody was moving helter-skelter looking for how to protect themselves, until when Nigeria began to have the perception that which is uncaught, that COVID did not kill Nigerians, then people began to protest the isolation and other stringent measures put.
All right.
During that period, a lot of claims were made, people were moving from one place to another, and this is the implication.
Okay.
So we don't know when the next pandemic will come.
Okay.
If the government is not deliberate about local manufacturing, then if unfortunately we get another COVID or another pandemic in the next, only God knows, yes, then at the end of the day, Nigeria is going to be in a very hot ship.
All right, Dr. Nuruddin Usman, a pharmacist, thank you so much for sharing your thoughts with us on the program this morning.
Thank you very much.
All right. Okay, and that's just about it for Eagles Outlook this week. Thank you also for spending part of your time with us, and we trust that you had a great time listening. It was quite educative and informative. I'd like to say very clearly that the views expressed by the guest and the contributors on the show this morning were not influenced by Eagles FM 102.3 Abuja. My name is Omohefe Peace Osemere. Good morning.
Eagles 102.3 Abuja.
This is Eagles 102.3 News.